humanity entered a new era of medical triumph. Vaccines expanded, antibiotics saved millions, and global health systems grew stronger. But even as the world celebrated, a silent danger was rising. Bacteria were adapting, viruses were learning, antibiotics, once the miracle drugs of the modern age, were losing their power. This is the story of resistance and recovery, and at the center of it stands one man whose courage would change global health forever. Born in Italy in 1956, Dr. Carlo Urbani believed that medicine was more than science, it was service. In late February 2003, Dr. Urbani was called to the French hospital in Hanoi to examine an American businessman with an unusual severe case of pneumonia. Dr. Urbani quickly realized it was not the flu but an unknown, highly transmissible illness. Dr. Carlo Urbani identified SARS and saved millions, then became its victim. In 2003, every other doctor said it was just influenza. Urbani looked closer and realized this was something entirely different, something the world had never seen. He immediately contacted the World Health Organization and insisted they treat this as a global emergency. His warning triggered quarantine protocols across Asia that stopped SARS from spreading into a full-blown pandemic. He worked at the hospital for several days, organizing infection control procedures, implementing quarantine measures, and supporting the staff despite the personal risk. His vigilance meant that patients were identified and isolated before the outbreak could escalate into a wider pandemic in Vietnam. Here's what makes his story devastating. Urbani knew the risk he was taking. Every time he examined patients, collected samples, studied this mystery disease, he was exposing himself to infection. He did it anyway because someone had to figure out what this was before it killed thousands. 3 weeks after raising the alarm, Dr. Urbani contracted the virus himself while treating patients. He was isolated and died in Bangkok on March 29, 2003. Even as he was dying, he kept calling colleagues with observations about his own symptoms, trying to help them understand the disease better. He was 46. His wife and 3 kids were back in Italy waiting for him to come home. Before SARS, Urbani had spent years in poverty-stricken areas fighting parasitic diseases nobody else cared about. Before his pivotal role in the SARS crisis, Dr. Urbani had a distinguished career in infectious diseases and a strong commitment to humanitarian work. He worked as a clinician in the Department of Infectious Diseases at Macerata Hospital in Italy. His legacy is one of heroism, professionalism, and self-sacrifice. UN Secretary-General Kofi Annan praised his actions, stating that, had it not been for his recognition that the outbreak of the virus was something out of the ordinary, many more would have fallen victim to SARS. His protocol for containment was later recognized as an inspiration for dealing with the COVID-19 pandemic. He is remembered by the WHO and the global health community as a hero who dedicated his life to serving humanity. Urbani's work reshaped global outbreak preparedness. His warnings about antibiotic resistance pushed nations to rethink how they use medicines. And the systems he helped build, early detection networks, rapid response teams, global communication protocols, remain the backbone of disease control today. From the 1960s to the 2000s, humanity learned a hard truth. Our greatest threats are often invisible, and our greatest defenders work quietly in their shadow. Dr. Carlo Urbani was one of those defenders.